Okay, moving on now to our messaging suite for healthcare, which shows our staff efficiency and patient flow. We've got here administration, staff assignment and staff scheduling. So first of all, we're going to look at staff scheduling. Here, you can control the staff members that are on your unit or your ward, and you can assign who is actually working that day. So for instance, here we've got Hyrule and Kirsty who aren't actually on any assignments yet. So if we drag and drop them onto the shift, they now will become available for us to use when we actually assign nurses and doctors to patients on the actual ward. So if we now exit the scheduling piece, we can move on to staff assignment. Now, staff assignment is where you can assign the nurses and the doctors or groups of nurses to particular alarms or particular beds and patients within your ward. So here we have our nurse call setup. So I've got a yellow team as the first responders, which will actually incorporate a few nurses on shift. And if they don't respond, it will escalate to the next team of nurses and then finally to an individual if required. So if we activate a nurse call, this will come through to a handset and it gives the nurses the option to accept that call and stop the other nurse from having to walk to the bed at the same time. Down the right hand side of the screen, we've got the different types of calls that we can assign from our nurse call. So we can assign assistance calls if nurses need help. And again, you can drag and drop in different nurses or different doctors to help with those assistance calls. We've also got emergency calls, again, so you can activate an emergency call at the bed to bring a crash team perhaps, or again, another group of nurses to the bed. We can also incorporate medical alarms and patient monitoring so that you actually get the information direct to the nurse that is dealing with that particular patient. All this will help with efficiency and just saving the nurses time in having to walk backwards and forwards to the nurse station to see which light or which indication is going off to which bed.